Today we're going to talk about depression. So there are quite a few types of depression, but here are the ones we're going to cover in this class. Clinical depression, persistent depression disorder, seasonal affective disorder, and postpartum depression. Within postpartum depression, we'll focus on three further diagnoses: the baby blues, postpartum depression, and birth-related PTSD. Clinical depression. Clinical depression is what most people mean when they refer to depression in a conversation. Depression, also known as major depressive disorder or clinical depression, is a common but very serious mood disorder. It affects how you feel, think, and handle daily activities such as sleeping, eating, or working. In order to be diagnosed with depression, symptoms must be present for at least 2 weeks. Clinical depression is treatable with medication and/or psychotherapy. Psychotherapy is also referred to as talk therapy. This is where you would meet with a psychiatrist. It is characterized by persistent feelings of sadness and loss of interest. You may have trouble doing normal day-to-day activities, and sometimes you may feel like life isn't worth living. In essence, you might contemplate suicide. This is something you cannot just snap out of. Here are the symptoms of clinical depression. Feelings of sadness, emptiness or hopelessness, angry outbursts, irritability or frustration, loss of interest or pleasure in most of or all normal activities, such as sex, hobbies, or sports. Sleep disturbances, and this can happen in either direction. You may have trouble sleeping or you may be sleeping too much. Tiredness and lack of energy, reduced appetite or increased appetite, anxiety, agitation, or restlessness, slowed thinking, feelings of worthlessness, troubled thinking, frequent or recurrent thoughts of death, suicidal thoughts, and unexplained physical problems such as back pain or headaches. For many people with depression, symptoms are usually severe enough to cause noticeable problems in day-to-day activities. Some people may feel generally miserable or unhappy without really knowing why. Symptoms in teenagers and children. In younger children, symptoms of depression may include sadness, irritability, clinginess, worry, aches and pains, refusal to go to school, or being underweight. You can imagine that these symptoms are often hard to recognize in teenagers because most people consider teenagers to already be very moody. So in teenagers, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance in school or poor attendance, feeling misunderstood and extremely sensitive, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest, and avoidance of social interaction. So again, it can go undiagnosed in teenagers because parents or guardians often dismiss it as people just being teenagers, which is very dangerous. Unfortunately, depression often goes undiagnosed and untreated in older adults as well, and they also may feel reluctant to seek help. Symptoms of depression may be different or less obvious in older adults, such as memory difficulties or personality changes, physical aches or pains, fatigue, loss of appetite and sleep problems, or loss of interest in sex, often learn to stay home rather than going out, and suicidal thinking or feelings, especially in older men. So again, this can be pretty dangerous for older adults as they're more reluctant to seek help, and it's hard to see these symptoms, especially when associated with old age. So there are a few possible causes for depression. First, we have biological, psychological, and social sources of distress. Research demonstrates that these factors may cause changes in brain function. We have hormone changes. The changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during the weeks or months after delivery, and from thyroid problems, menopause, or a number of other conditions. Inherited traits. Depression is more common in people whose blood relatives also have this condition. Researchers are trying to find genes that may be involved in causing depression. And again, you can also have social sources of distress. So you can imagine some event triggering a depressive episode for you. Depression often begins in the teens, 20s, or 30s, but it can happen at any age. More women than men are diagnosed with depression, but this may be due in part because women are more likely to seek treatment. So keep in mind that these risk factors may not be completely accurate. Right? Men and women may be equally at risk, but women go to the doctor more often, men have more social stigma attached to depression, so the numbers may be skewed. Factors that seem to increase the risk of developing or triggering depression include certain personality traits, such as having low self-esteem or self-worth, being pessimistic, traumatic or stressful events such as abuse, the death of a loved one, difficult relationship, or financial problems, family history of depression, being lesbian, gay, bisexual, or transgender, while also being in an unsupportive situation, history of other mental health disorders, abuse of drugs, serious chronic illness, certain medications such as high blood pressure medications or sleeping pills. And this is important to remember. Some medications, a potential side effect is an increase in depressive symptoms. So there are obviously a lot of complications for all types of depression. So let's discuss the complications of clinical depression. Depression is a very serious disorder that can take a horrible toll on you and your family. Depression often gets worse if it isn't treated, resulting in emotional, behavioral, and health problems that affect every area of your life. Here are some potential complications: excessive weight, pain or physical illness, drug misuse, anxiety, panic disorder, or social phobias, family conflicts, social isolation, suicidal feelings, suicide attempts or suicide, self-mutilation, and premature death from medical conditions. The next type of depression we're going to talk about is persistent depressive disorder. Persistent depressive disorder is a depressed mood that lasts at least 2 years. A person diagnosed with persistent depressive disorder may have episodes of major depression along with periods of less severe symptoms. This type of depression is unfortunately very common. It is treatable by medication and psychotherapy. It's more common in females than it is in males, but again, this may just be due to the fact that women are more likely to seek a diagnosis. Symptoms prior to 21 years old is referred to as early onset, and after 21 it is referred to as late onset. The primary feature of this type of depression is the presence of depressed mood on most days for at least 2 years for adults, at least 1 year for children and adolescents. During this period, individuals are depression-free for no longer than 2 months at a time. So they go through depressive swings and non-depressive swings. In order to be diagnosed, you have to have 2 or more of the following symptoms: feelings of hopelessness, low self-esteem, low energy, poor appetite or overeating, difficulty with concentration, and difficulty with staying asleep or sleeping too much. Next is seasonal affective disorder. Seasonal affective disorder, often abbreviated SAD or SAD, is characterized by the onset of depression during the late fall and winter months when there is less natural sunlight. The depression is generally alleviated during spring and summer. Or it can be the complete opposite, where the onset occurs during spring and summer and people feel better during the late fall and winter months. General symptoms of seasonal affective disorder are the same as the previous types of depression. Symptoms can be unique to the seasons. So in the fall and winter, you may find yourself oversleeping, versus in the spring and summer, you may have trouble sleeping. Appetite changes in the fall and winter may include craving for foods high in carbohydrates, while in the spring and summer, you might have a poor appetite. Fall and winter, you may gain weight, while in spring and summer, you may lose weight. So what is the cause of seasonal affective disorder? The specific cause of seasonal affective disorder remains unknown, but some factors that may come into play include your biological clock. The reduced level of sunlight in fall and winter may cause winter onset SAD. Serotonin levels. A drop in serotonin, a brain chemical or neurotransmitter that affects mood, might play a role in this disease. Reduced sunlight can cause a drop in serotonin that may trigger depression. And lastly, melatonin levels. The change in season can disrupt the body's balance of melatonin, which plays a role in sleep patterns and mood. Risk factors. Seasonal affective disorder is diagnosed more often in women than in men. Seasonal affective disorder often occurs more frequently in younger adults than in older adults. Some other risk factors include family history, having major depression or bipolar disorder, and living far from the equator. SAD appears to be more common among people who live far north or south of the equator. This may be due to decreased sunlight during the winter and long days during the summer months. Next, we're going to discuss postpartum disorders. So you'll notice that in parentheses it says or peripartum with an asterisk. This is because postpartum suggests that this depression occurs after birth, when in reality it occurs around the time of birth, which peri means around. So you can develop this disorder right before birth, after birth, etc. So peripartum is the more appropriate term, but most people still use postpartum. So now we're going to discuss the baby blues. The baby blues affects up to 80% of mothers. It's characterized by general worry, unhappiness, and fatigue, and typically goes away after a few weeks. So this can be due to the onset of such a major life event, right? You've just brought a new child into the world, and that comes with a lot of stress. Okay? You're often very fatigued. Your body just went through a lot, right? And a lot of the pressure is put on the mothers. So keep in mind that this is very, very common. Postpartum depression. A mood disorder that can affect women after childbirth, characterized by extreme sadness, anxiety, and exhaustion. So the main characteristics include ruminating. Ruminating is when you can't get something out of your head. You just keep thinking about it and thinking about it, going over it excessively. Checking on the baby excessively. Intrusive thoughts. So this can be characterized by things you don't want to think, right? And it just keeps popping into your head. So like, what if I'm a terrible mother? What if I'm not good enough? What if something happens to my child? And then constant worry. So again, I need you guys to remember that the baby blues, although I think that's poorly named, is serious. It affects most women. It usually goes away. Postpartum depression is very excessive, very serious. It's not as common, but it is still very common. Symptoms of postpartum depression. Okay, there's a lot here, and they're very similar to the previous symptoms of clinical depression, but then we also have a lot that incorporates the baby specifically, okay? So, for example, having trouble bonding or forming an emotional attachment with her baby, persistently doubting her ability to care for her baby, and thinking about harming herself or her baby. Okay? So just like the other disorders, if this goes untreated, it can become very serious. Causes of postpartum depression. There is no single cause, but likely results from a combination of physical and emotional factors. It does not occur because of something a mother does or does not do. So we need to really focus on this fact, right? It has no significance to the type of mother you are. It just happens. So after childbirth, the levels of hormones in a woman's body quickly drop. This leads to chemical changes in the brain that may trigger mood swings. In addition, often mothers are unable to get the rest they need to fully recover from giving birth. Again, it's very important to realize that giving birth is a huge medical procedure, right? It's very dangerous, and we don't often talk about that. It takes a lot out of a person, and then once it's over, you immediately are overwhelmed with a ton of responsibility. Okay? So let's look at how the hormone levels change after you give birth. Alright, so this is a chart of hormones during pregnancy. You will see that estrogen, which is a common female hormone, slowly increases. Right? Progesterone also slowly increases. In HCG, which is the hormone that pregnancy tests check for when you take a pregnancy test, increase and then level out and begin to drop, and acne levels on there also increases with the influx of hormones. Okay, so increase in most hormones all the way to 9 months, and then upon delivery you can see how all the hormones severely drop, right, all the way down to 0. So we often talk about pregnant women as being very hormonal, very moody, right? And people like to dismiss the hormones, the role they actually play in pregnancy, but you need to keep in mind that there are some serious hormone changes going on after delivery. It's no surprise that women feel very poorly after giving birth. So here's another chart. It breaks down the hormones. I think this one's a little easier to see. Okay, so let's look at progesterone again. Okay, so very slow increase, big increase at the end of pregnancy. And progesterone helps establish the placenta, so it makes sense that it's very slow on the incline. Okay, and then let's look at relaxin. Relaxin inhibits uterus contraction to prevent premature birth. Right, it relaxes blood vessels, increasing blood flow. And the last one I want us to look at is oxytocin. Okay, this is produced by the pituitary gland, and you've probably heard of oxytocin before, right? It creates a bonding experience. It's released after sex, after you hug someone, etc. Okay, so oxytocin levels rise at the start of labor. You can see how severely it rises, stimulating contractions. It triggers the production of I can't say that word. We'll skip that, which increases contractions further. If labor doesn't start naturally, it can be used to induce it. Okay, so you have this huge increase of oxytocin, and again, this is a bonding hormone, which is completely necessary after you give birth. Right? If you don't feel very bonded to your child, it can be very difficult to recoup. Okay? So here are some risk factors for peripartum depression. Again, symptoms of depression during or after a previous pregnancy, or do you have a history of this? Previous experience with depression, family member, family history, a stressful life event during pregnancy or shortly after giving birth, such as a job loss, death of a loved one, domestic violence, or personal illness, medical complications during childbirth, and these are more common than people like to admit. Okay? Mixed feelings about the pregnancy, whether it was planned or unplanned, a lack of strong emotional support from her spouse, partner, family, or friends, and alcohol or other drug problems. So here are the treatment options for peripartum depression. Medications. Antidepressants are typically, not always, but typically safe to use while breastfeeding. Counseling. There's 2 types of counseling that are shown to be particularly effective with this type of depression. Cognitive behavioral therapy, which is effective for most types of depression, helps people realize their which helps people recognize and change their negative thoughts and behaviors. And then we have interpersonal therapy, which helps people understand and work through problematic personal relationships, which could be the cause of the depression. If left untreated, this depression can last for years, and I can't emphasize enough, okay? It's already incredibly detrimental to live with depression, especially when it's untreated. It can really, really damage your life, your quality of life, but when you think about peripartum depression, you're also left with this child you have to take care of, okay? So you can drastically reduce the quality of its life also. Right. Birth-related PTSD. I'm willing to bet that most of you have never thought that birth or delivery of a child can cause PTSD, okay? But it affects approximately 9% of women after childbirth. This illness is caused by a real or perceived, emphasis on the perceived, trauma during delivery or postpartum. Okay, so I want to really emphasize this point. You can give birth and experience some real trauma, or you can perceive it as being very traumatic. Okay? So, for example, let's say I'm giving birth, right? It's been months and months and months. I have planned exactly how I want my birth to go. I'm going to do it naturally, no epidural, right? I'm going to be a gold star mother, which is what people think makes you a gold star mother. But something happens and I unexpectedly have to get a C-section, okay? An unplanned emergency C-section, which is a major surgery, okay? That can be extremely traumatic, even if physically everything went well, okay? It's the emotional reaction, the perceived trauma of the event, okay? Keep that in mind. So some birth-related PTSD causes might include a prolapsed cord, an unplanned C-section, use of vacuum extractor or forceps to deliver the baby. You can imagine that visually these are very, very scary. The baby going to the NICU, the neonatal intensive care unit. Feelings of powerlessness, poor communication, or lack of support and reassurance during the delivery. Now, this is not always the fault of the medical doctors or medical professionals, but it can be, right? If you have a doctor you don't feel comfortable with, if you're not able to get the doctor you've been working with, if you have poor nurses, it can cause an extreme amount of stress. Women who have experienced a previous trauma, such as rape or sexual abuse, are also at a higher risk. Women who have experienced a severe physical complication or injury related to pregnancy or childbirth, such as hemorrhaging, unexpected hysterectomy, severe preeclampsia, eclampsia, perineal trauma, 3rd or 4th degree tear, or cardiac disease. Now, if you are not familiar with any of these terms, I suggest that you Google them and see what I'm talking about. Symptoms of birth-related PTSD. Intrusive re-experiencing of a past traumatic event. So this could be the childbirth itself. So again, if we imagine we've had to have an emergency C-section, we might keep thinking back to that, right? Having flashbacks of it. So again, flashbacks or nightmares of the event. Avoidance of stimuli associated with the event, including thoughts, feelings, people. So again, if the event is childbirth, you might feel really reluctant to engage with the child itself. Persistent increased arousal. So again, arousal is just the state of attentiveness you're at, right? You might be very irritable, have trouble sleeping, you might be hyperactive, but not in a beneficial way. Okay, you might be very easy to startle. Anxiety and panic attacks, and feeling a sense of unreality and detachment from oneself. So you might feel like this isn't really happening, I didn't really give birth. You might just feel like you're kind of like a floating shell of yourself.